are around the world. In October of 2010, Guatemalan President Álvaro Colom called the experiments conducted by the U.S. government in Guatemala on hundreds of unsuspecting Guatemalans as a crime against humanity.
It's an incredible violation of human rights, but there it is. We must face it. And we're going to do whatever is necessary so that we can find out quickly the effect on people, because what we're interested in is the victims. Obviously indignant. And if there were officials from the past who were involved in this, that also needs to be told.
That was the Guatemalan president, Piper Hendricks. Can the Guatemalan government bring this case to an international court?
They could. We have not been working directly with the Guatemalan government. We filed our own case here in the United States, but given the crimes involved, that would be a possibility where should they want to pursue it.
I wanted to turn right now to President Obama. In 2010, State Department spokesperson P.J. Crowley said the Obama administration had apologized to the Guatemalan President Álvaro Colom.
Yesterday afternoon, Secretary Clinton called President Colom of Colombia to express both her shock at the discovery of the details of this research and also to apologize on behalf of the American people. During the course of the conversation, she also invited Guatemala to participate fully in the investigation that we will carry out to determine the facts behind this research.
Anita Allen, professor at the University of Pennsylvania Law School, also serving on the U.S. Bioethics Commission that has just revealed even more of the gruesome details of these U.S. government tests on unsuspecting Guatemalans from 1946 to 1948. How will your commission, the Bioethics Commission findings, be used by the Obama administration? Will there be reparations recommended for the victims?
Let me point out something that has not come out this morning so far. The Guatemalan government was completely on board with this research. The Guatemalan government and the U.S. government entered an agreement about the research. Guatemalan doctor Juan Funes brought the idea of bringing research on STDs from the United States to Guatemala after he had spent a year working with Dr. Cutler and his colleagues in Staten Island. The health ministers of Guatemala approved the research. So that when we talk about liability and about responses, we need to look at all of the culpable parties that include not just the United States and its doctors, but also the Guatemalan government and its physicians and researchers who helped with the protocol and knew about the details of the protocol. So while we may need to look, and we are going to be looking very carefully at the question about U.S. responsibility and culpability as far as reparations or compensations is concerned, we have to look at those issues. We're looking at the question not just in terms of U.S. liability and responsibility, but also Guatemalan liability for complicity with a horrible research protocol that affected its own people.
Piper Hendricks, your response.
I would agree with Professor Allen on that. I think something that's very important to remember is when we're looking at the recommendations of the Commission, it's encouraging to think that going forward we will not make these mistakes again. However, it's very important that the research team involved not depend entirely on the community. There's some recommendations that you be involved with the community, and I agree. However, in this example we have in Guatemala, as Professor Allen mentioned, the institutions were complicit in these experiments. They were not seeking consent of the people involved. Instead, you sought consent of the mental institution. And so there were Guatemalan officials who were, whether they knew exactly what was going on is not clear, but it's something that's very disturbing that, there may be some murky areas still in international law, but one thing that is absolutely without question is that non-consensual human medical experimentation is beyond the pale. And so to have that going on in the time when we had Unit 731, when we had Nuremberg, there was just no doubt that what was going on was extremely problematic, and to seek the consent of the orphanages and of the institutions rather than the people themselves is without a doubt absolutely illegal.
I'm looking at a piece in the New York Times called "Panel Hears Grim Details of Venereal Disease Tests." And it talks about the most offensive case, colleague of Anita Allen on the White House Presidential Commission, John Aris, a bioethicist at the University of Virginia and panelist, was that of a mental patient named Berta, he described. She was first deliberately infected with syphilis and months later given penicillin. After that, Dr. John C. Cutler of the Public Health Service, who led the experiments, described her as so unwell that she appeared she was going to die. Nonetheless, he inserted pus from a male gonorrhea victim into her eyes, urethra, and rectum. 4 days later, infected in both eyes and bleeding from the urethra, she died. I mean, these are gruesome details, Professor Allen. How...
They really, really are.
So at this point, what are the plans of the Presidential Commission for the study of bioethical issues? Now you have gone through the fact-finding phase.
Yes. We intend to issue a report. It will probably be in the neighborhood of 180, 200 pages in September. This report will reveal all of our historical research that will describe the case of Berta and other similar patients who were affected in their situations. And then we're going to also have a forward-looking study that will look very carefully at the question of what can we do to make sure this kind of thing doesn't happen again. We're also, though, right now we're surveying all the federally funded human subject research around the world so we can understand how much of it's going on. We're looking at all the standards, the ethical standards in place, the government standards, the private standards. We're looking comprehensively at what are the governing ethical norms today that will ensure that these kinds of things won't happen again. All that's happening. I think, you know, for me personally, one of the greatest tragedies of Guatemala was that the experiments happened at a time when Guatemala was experiencing a degree of freedom. It had been a country ruled by dictators for many, 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 many years since its independence from Spain in 1821. There was a great emphasis on labor unions, on free speech, political parties, and an attempt to bring together the ethnic groups, the native indigenous Guatemalan Indians and the Latinas. But this project sort of came at a time when concern about health, ironically, caused Guatemalan doctors to welcome U.S. researchers to try to help them with their STD problem, probably not realizing the full extent of what would be done, but being complicit to a tremendous degree in efforts to use vulnerable populations who could not give consent in controversial research that could not be done in the first world.
Piper Hendricks, the U.S. presence in Guatemala at that time was, to say the least, very controversial as well.
Mm-hmm. Yes, it was. It was. And one thing that I'd like to note, Amy, is that as we're waiting for the report, our case has been put on hold for a bit, waiting for the Commission's report to be released. And I think now that there's no question that, and there never has been, I mean, there was the apology that you mentioned last October with the U.S. admitting that there was culpability there. In the time since we filed our case in March, we've already had one of our victims pass away. I mean, this is something that happened many, many years ago, and people have been waiting for decades to see justice. So we have a hearing this Friday in the case. I'm hoping that it can move forward before the final report is released, because really time is of the essence to address the horrifying things that people went through back in the late 1940s.
Well, I want to thank you both very much for being with us. Piper Hendricks at Conrad Shearer Law Firm in Washington, helping prepare a class action lawsuit against the U.S. government on behalf of hundreds of Guatemalans, over 700 unknowingly infected with syphilis from 46 to 1948 in this American medical experiment. And I also want to thank Anita Allen, a member of the Presidential Commission for the Study of Bioethical Issues, the Henry R. Silverman Professor of Law and Professor of Philosophy at the University of Pennsylvania Law School. We will speak again as this case and others are investigated. That does it for our broadcast.